What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe and healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, hopefully you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, August 18th, 2023. Today I thought we would start off again talking about that new variant, BA 2.86, because I'm seeing a lot of people posting questions to different people on Twitter, and I just want to make it perfectly clear what we know, what we don't know. I mean, I'm seeing some people already, right off the bat, they're drawing some conclusions on what they think the severity is going to be. And here's the deal. The WHO, World Health Organization, the WHO, is monitoring a highly mutated new strain of COVID-19 now spotted in Michigan. There are 30 mutations in the spike protein. Do we know if it's going to be more immune evasive? No, we don't. Is it likely that it could be? Yes, of course it is. I mean, when you see something that is so much different like this, it could be more immune evasive. Do we know if it's going to be more severe? No, we do not know if it's going to be more severe. We don't know if it is more severe. We don't know if it's likely to be more severe because, again, this is something it's relatively fit, and it's a descendant of the old BA.2 variant. Now remember, the BA.2 was, quote, supposed to be mild, but as we all know, there were a lot of long COVID cases with that, with people who went on to develop long COVID. And because there are such changes, some are saying this could be, or this should be named the Pi variant. We've heard people say that many of times before. At some point, will we see something that's not Omicron? Yes, I do believe we will be. Is this that? I don't know. I honestly don't know. Is this going to stand up against the new boosters? I don't know about that either, because the new boosters, as of right now, Moderna just said it's going to be relatively effective against the EG.5 and the FL1.5.1 variant. Here's the problem. This is a descendant of the old BA.2 variant, which is a different lineage, so it's still early in the ball game. We're watching this as it unfolds. We can come over to this now. Denmark reported the third case of the new COVID variant, BA.2.86, raising the total 6 in 4 countries. What are those 4 countries? Israel, Denmark, UK, and United States. It's early in the ball game. We'll probably watch over the weekend what happens. As you know, there's not a lot of data over the weekend, but with what's going on here, there is a big call from scientists far and wide around the world. I'm seeing it on Twitter. They're asking, please share any sequences you get. So people are actually taking this serious. There's a rush to find out what this is about. You know, it could end up being a whole bunch of nothing, or it could end up being something very serious. And we're seeing a lot of big names in virology science start to take interest in this. Because you know what? They want to know what's going on. We also saw the tweet yesterday where someone said that at JFK Airport, the CDC was voluntarily asking people, would you mind taking a COVID test? Would you want some free at-home tests? But here's the catch. If you want the at-home test, you have to do a test right here. We want to know if you have COVID, and I'm assuming they are sequencing those cases as they find them, because they want to know just what's the deal with this BA 2.86. So that's what we know right now. In the coming weeks, we'll know more. Hopefully within the next 2 weeks, we should have a better understanding, at least where this is going to go. And here's one thing I do want you to keep in mind. 2 things, actually. Number 1, if we're already finding 6 cases of this so quickly, it's likely in more cases than we know. Sequencing, it's not the greatest. It's actually even less now than it was a couple years ago, because, I mean, a lot of people are laid back about data. And number 2, Michigan, yet again. Michigan's one of the early states to find something. I just find that rather interesting. And that was the case with monkeypox as well, or Mpox. Back then it was known as monkeypox. We now call it Mpox. So this is something that I want you to pay attention to. And my personal take here is that we need to wait 2 weeks. Give it 2 weeks. See what happens. We cannot draw any conclusions, but the only thing that I think probably would be likely, because people have not gotten boosters, people have not been infected in a while, it's probably going to be able to cause a surge and probably be more immune evasive. Anything else, I'm not going to comment on. It's going to be just a wait and see. All right, moving on to this. Speaking of Mpox, I wish we had some wastewater data out of Canada. You know how we used the wastewater scan site? We can detect other things. I wish we could see what Mpox is doing in Canada. Ottawa, Public Health is saying that they're urging vaccination after 2 people have tested positive for Mpox up in Ottawa. So that's relatively interesting. And then we come to this. This is something else that it's a growing issue again. Air quality in the United States, in many areas, it's starting to drop. You can see here across the Great Lakes. Then you have the Pacific Northwest. The Great Lakes, this is just a widespread area of poor air quality from wildfire smoke. But then you have 2 concentrated areas in the Northwest and even up in Canada where it's just really unhealthy air quality, where if you're going to leave your house, you should be masking because it is bad. And you should have your air purifiers on up in those areas. I mean, we do have some better areas like the Four Corners region, New Mexico, Arizona, Utah, Colorado, and parts of the Northeast. But I hate to tell you, the Northeast, though, there's less humid conditions coming. There's nice weather coming. This wildfire smoke, it may come out to play this weekend, and it's already starting to drop the air quality along the I-95 corridor from Philadelphia down southward, and look what's back to the west. Yes, it's not that great. And again, if you're on the West Coast, there's some really bad air quality. But you're getting a double whammy, as that may clear this weekend because you got a storm system coming. You're going to deal with the wrath of Hillary. For the first time ever, Southern California has a tropical storm watch. We're talking about Hillary over on my other channel, Climate Data Report. We're going to have an update on that right after this video, and we'll probably likely have several updates this weekend. It's something we're watching. It's the first time there's ever been a tropical storm watch in Southern California. So, yes, this is the real deal. At Climate Data Report is my other channel. All right, I wanted to show you something on Walgreens, but look what happened here. Walgreens just went to absolute nonsense. I don't know what that's all about. Let's take a look at a few of those wastewater sites that show other things besides just COVID. Today, let's take a look at Las Vegas, Nevada. I'm going to move myself to the left and take a look at this. We're seeing a rapid rise in COVID there. Influenza not detected. RSV not detected. HMPV not detected. Mpox not an issue. Norovirus, it's there. It's in low levels, but it is dropping at this time. And what do you say we take a look at one more site down in Texas, and then we do have some new data from the CDC to show you. We'll come down near Houston, and we'll take a look at this Woodlands site, shall we? And in Woodlands, you can see COVID was rising. Now it's dropped ever so slightly. Influenza, it is 0 now. It was a little higher recently, but now it's dropped back to 0. RSV, not an issue. HMPV is not an issue. No Mpox. And norovirus, it's there, but it's dropping at this time. Taking a look at BioBot wastewater update. You can see the Midwest, it did drop ever so slightly. The other 3 regions continue to rise, and that is concerning. Speaking of concerning, I have to show you this. We'll have our full wastewater update on Sunday. Ooh, this is not good. California, a lot of moderate to red. Washington, some moderate to red. Orange and red colors. And look at the East Coast. Loaded with orange and red sites. This is really, really bad at this time. The numbers here show, we'll just do the moderate to high sites. There's now 212 orange sites, 52 red sites. Who remembers a little over a month ago when I was up in Maine? I was up in Maine. I was away. Luckily, transmission was still low. I was at my relatives for 2 weeks. Who remembers? There were hardly any, at that point, in the entire country, there were hardly any red to orange sites. I think we at one time had a point where there were 0 red sites. 0. And look what's happened now. There were under 20 orange sites. There's now 212 of them. That's not good. All right, we got more data to show you. Speaking of orange, you're seeing this on the emergency department visits. Yeah, the majority of the country is rising now. There's not one site on here, one state on here that is dropping. Yes, there's 4 states we can't see, but there's not one that's dropping at this point. There's some that are stable, but there's many that are having moderate rises. Like, here's a moderate increase in Utah. Then you go next door to Nevada, substantial increases of emergency department visits for coronavirus. They've tested positive, or they have symptoms and they test positive at the hospital. There's moderate to substantial increases basically across most of the country at this point. Every region of the United States has multiple states with moderate to substantial increases at this point. I mean, it's good to see Florida stable, but again, it's still high numbers, so this is not good. I mean, you're seeing some states here where we take a look at the states, like for example, Florida. 3.2% of all emergency department visits are now for COVID. That's not good. Let's go up here to Oregon. Looks like Oregon's at 1.5%. Maine's at 1.5%. New York is, okay. It's around 1.5%. But again, some of these states, it's concerning numbers. Texas, 2%. How about Georgia? 1.6%. You can see here. So, yeah, it's a decent number of states that's going up at this time. Speaking of more data, we do have something today for this day in pandemic history. Sometimes we skip over this segment. Today I want to show this. On August 18th, 2021, CDC announces a new center, the Center for Forecasting and Outbreak Analytics, CFA, it's what it stands for. It's kind of like weather forecasting, where they decide to start a forecasting for viruses, which aims to improve the nation's ability to forecast and model emerging health threats, including pandemics like COVID-19, using data analytics. So yes, on this day, on August 18th of 2021, they did start that new center. All right, we do have some new data today on the variant standpoint. Nationally, no, we're not going to read all these numbers. We're not going to read all of them. There's close to like 25 of them now. AG.5, 20.6%. FL 1.5.1, 13.3%. XBB 116, 10.7%. XBB 2.3, 10.6%. Then you come down here, you do see there are a few new ones, like, what's this? There's a GE.1 now. That's at 1.8%. There's now an EG 6.1. That's at 2.3%. There's a whole bunch of EBBs. And you can see here, there's quite a few different variants. Let's take a look at New York. We're not going to do a full variant update video this week like we used to do. Some regions don't provide any data at all anymore, so I don't think it would make sense to do that if we can't do all regions. In the New York, New Jersey, Puerto Rico, Virgin Islands region, FL 1.5.1 is now 23.5%, and EG.5 is now at 18.7%. So that it's not good to see that variant up there. What we don't see in any of the regions is that BA 2.86 variant. Hopefully I'm saying that correctly. That is, yes, BA 2.86. That is one we do not see yet. Eventually it will come into play. All right, we do want to take a look at this. New Jersey hospitalizations today, 295. That's actually not a bad number because, look at this. It's actually been starting to drop. So hopefully that can sustain itself. On a ventilator, 11 people. In the ICU, 33 people. Now let's take a look at EMS incidents in Philadelphia. There were 818 of them yesterday. Let's take a live look at the suburbs. And I want you to see this, moving myself to the right. And actually, I did not refresh this. That's fine. Just about 45 minutes ago, Montgomery County, just outside of Philadelphia, there were 38, yes, 38 active EMS calls on this map. Now, sometimes this map lags. Some of them are completed, but it'll stay on this map a little bit longer. Doesn't really make a difference. 38 within any hour's time frame. That's a heck of a lot of calls for an ambulance in a county. I mean, that's just really not good at all. And here's your live look, and you can see, it's 13. That's a lot less than 38. This map right here, I can actually, or this chart right here, was actually up to 26. Here's what it looked like. Yeah, like really concerning. Dizziness, respiratory emergencies, heart emergencies, cardiac emergencies, general weakness, vomiting. I mean, you name it. Any type of incident, it was happening. You can also take a look at Chester County. Chester County's busy as well. Wow. Sick person, sick person, sick person. Heart problems. And you're seeing 3 calls here for fall. Sometimes we have heard of people who are positive for COVID have issues with falling down. All right, moving on now. Let's take a look. Do we want to take a look at Maryland today? No, we'll take a look at the Maryland divert statuses tomorrow. I think we will. Let's take a look at New York State. 1,266 new cases. It's a day over 1,000. Any day over 1,000 is bad news. And I know you're saying, well, New York State has millions of people. Wait, don't come with me with that. Testing is terrible right now. They don't report reinfections in this daily number. And at-home tests, you know, the little tests that are about this size right here, the at-home test, they're not reporting this number as well. So this does not include, and then, hey, a lot of people do not want to test as well. Taking a look at the positivity, 14.4% positivity. That's higher than the 13.67 day average, so that's not good either. And let's take a look at hospitalizations. We can give you a little bit of good news here. Here's New York City first, since I already have it up. 428 people in the hospital in New York City. ICUs 41. Again, it did not really rise. Look at that. Same number 3 days in a row. Let's go to all regions now, and you're going to see here, it actually has been dropping, but, keyword, but, it's still higher than any day last week. We're in this pattern now, where Tuesday comes, it starts the new week, it starts off higher than any day of the previous week, then it comes down a little bit, but remains higher than any day of the previous week. So I suspect come next Tuesday, it's going to be higher than any day of this week because we're still seeing cases go up. The level of infections is still increasing in New York State. The statewide number is 926 hospitalized, 91 people in the ICU. All right, we do have some numbers to run to you out of California. Positivity rate. Unfortunately, it's gone higher. Look at this chart. Everything's trending higher. Cases, too. 11.8% positivity. I believe it was 10.1% on the previous one. That's a pretty big increase. Deaths, 9 average daily. And then new hospital admissions. 283 is now the daily average. You can see that is trending upward. While deaths are trending down, that's because, remember, deaths are the last lagging indicator when it comes to a wave. So right now the admissions are rising, and the cases are rising, and the positivity is rising. Don't worry, there will still be deaths with this wave. It'll just be the last thing that we see rise. All right, let's take a look here. What else do we want to take a look at? Let's do a little bit of an international update. Just a quick one. And there is something I want to bring to your attention. You know, I always talk about these percentages, but I just noticed something. Don't ask me why I didn't mention this before. It's very well worth mentioning. South Korea, 55% decrease, but look at this. At this day and age, when testing is just lousy, still in a 7-day period, 160 new infections. Yeah, that's down from 359, but I think that's a lot of infections, don't you? I think that's a pretty high number for a period of time when testing is way down. New Zealand down 38%. And then we come down here to a whole bunch of places that are rising. Switzerland, cases up 62%. Mako, 19%. Thailand, 19%. Vietnam, 34% up. These are all increases. India is down at this point. And then we take a look here at Norway, still up 16%. Australia is up 90%. Afghanistan is now down 38%. And we're also seeing Denmark. We really need to watch Denmark. 63% increase, 67% increase in deaths. Let's take a look at the latest flu numbers real quickly. And, well, I got a whole bunch of nothing to show for you here. The only place that's low, which, again, there's insufficient data, minimal, low, moderate, high, and, well, as of last year, very high was added to this category. The only place that's higher than minimal at low would be New York City. I don't see anywhere else. Nope. So for all of you fans out there of, oh, it's just the summer flu, you're getting the green light here. It's not high. There may be some flu cases in New York City. Yes, there may be a random one in any place, but For the most part, flu is minimal right now. It's not the summer flu, folks. You saw the wastewater. Look at this. Look at this. Look at all these orange and red sites. It's COVID. If you are feeling sick and you test negative on an at-home test, test again. If you can swing it, if insurance can pay for it, or if you can afford it, get a PCR test. I'm telling you, test multiple times. It very well could be COVID. Alrighty, my friends, that does it for today's pandemic update. My weekly reminders to you, because we're headed into the weekend. Risky activity tends to happen over the weekend. There'll be lots of it this weekend. It's back to college. Football is starting up. There's these preseason games. Fall activities are starting to come into play. They're going to be in full swing soon. That also means increased COVID transmission. People are going to start going indoors soon. Parts of the north. This is where weather comes into play again. Weather and COVID. Where people may start going indoors. There's going to be some cool temperatures at night this weekend. Watch for increased COVID transmission. Alrighty, my friends. Have a safe weekend. We don't take the weekend off. We'll be here tomorrow with a pandemic update. We'll be here Sunday with the wastewater update. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs a reminder that the pandemic's not over, again, there's only 212 orange sites on this map, 52 red ones now. Yeah, that's really, really bad. By all means, share this with them and tell them that, hey, we're going to be doing COVID and wastewater on Sunday. I get a lot of people that tell me, I never knew COVID could be tracked in wastewater. Yes, it can be. We track it here on this channel. Alright, guys, see you all again next time. But until I see you again next time, stay safe, everyone. Have a great afternoon. Have a fantastic weekend, but have a safe weekend.